myself, even though I know every single one of you. But I'm Dr. Heineman, and Megan Dirks is our nurse practitioner that also does the BioT. So we're going to introduce you to the world of hormone optimization, and we have a couple patients here. We're going to talk about their experience, and then we'll open it up to questions. I'm going to try to make this fairly quick. I don't want it to last really long. Our last seminar went really long. Someone else came to talk, and we're going to try to make this a little quicker this time. So what we're talking about tonight is BioT. It's a type of hormone pelleting, and we're going to explain a little bit more about what that means and whether or not hormone optimization is for you. So over the years, we've often treated women and men alike for hormones based on kind of some old methods and also some studies that were fairly flawed. So we're going to talk about some changes in thinking and where the pelleting fits in. So we're going to talk about what are hormones, why they're important, and then also why are there different opinions? Because you may have other physicians you may talk to who are like, oh, what do you mean they're putting testosterone pellets in you? That's not right. And so we'll talk about why there's those differing opinions and what's out there, and then also what can you potentially do if you are interested. So first we're going to talk about just what are hormones. Hormones, I always describe them like the key that unlocks the potential. The best one that I feel like is illustrated well is insulin. So you hear people talk about insulin if they're diabetic, and insulin's like the key that lets in the sugar into the cell for it to do its job. In the same way, we have hormones that unlock some potential for our tissues and our bodies, and those can include estradiol, testosterone, our cortisol, our thyroid hormones. There's just a lot of different hormones in our bodies. So over the years, we've often said that, well, as we age, it's natural for us to lose our hormones. And what we're seeing in some research that's been available now in the last 10 years or 15 years is that maybe it's a little bit of a different kind of thinking, that we lose our hormones and then we start to age, or at least we start to feel our age. So I'm going to ask our patients to come up, and we have a couple patient volunteers coming to talk about their experience with BioT, and then we'll go into kind of more details. So Sarah Hawkins is our first one, and she'll kind of give you her first little thought on it.
Okay. My name's Sarah Hawkins. Give you a little bit of background on myself. I am 46 years old, 3 kids, 3 teenagers. Awesome kids, happily married with the same guy for 21 years. My life is great, stable, everything is good. But over the course of the last 3 to 5 years, really last 3 years, I would say, I've really not been feeling good, and I didn't really have a reason why I shouldn't be feeling good. Just struggling with a lot of anxiety, I guess, would be the greatest thing that my biggest symptom that I was noticing. Even when things were going really well, getting enough sleep. Dr. Heineman and I have talked about all the things you're supposed to do to feel good, right? We all know all the things. If you read like a self-help article, it would say you should exercise daily. I do that. You should watch what you eat. I do that. And you should get enough sleep. I do that. So I was doing all the things, and I still just wasn't feeling good, and not feeling as good as I felt like I should feel. And so I'm also an occupational therapist. I work here at the hospital. And so I was seeing these flyers all over the hospital, and one day I read one of them, and the symptoms that were listed on there, I was like, this sounds like me, you know, the little thing you guys just filled out there, you know, do you have fatigue? Yes. Decreased sex drive? Yes. Or no sex drive? Yes. Trouble sleeping, irritability, anxiousness, mood swings. Another thing I had was my hands and feet were cold all the time. And that wasn't on the list, but later on I learned that that's something that was likely caused by hormones. headaches. I was noticing that I felt more anxious and moody, and had bad headaches. Couldn't sleep the week before my period, so that made me start to think, okay, maybe this really does have something to do with hormones. So I made an appointment. I initially saw Megan and talked with her about how I was feeling, and I was fully ready to go on some kind of anti-anxiety medication. I really thought that I needed to do something, but we talked about the BioT, and it sounded like I really think this might help me. So made an appointment, got the labs done, talked with Dr. Heineman, and I found it fascinating to see what's going on inside my body and to have a reason for why I was feeling the way I was feeling. It's really amazing to see that. And so I had my first pelleting in April, and about a week after I got the pellets, I started feeling so much better. Another thing that I was noticing before the pellets was I just have no energy in the afternoons. Just felt like I just needed to take a nap. I just couldn't even put together a sentence. It was just like this mental fog. And I remember thinking back to earlier in my life, like when I was in my 20s, I didn't feel that way. I didn't, I would take risks. I was willing to do new things. I felt good. I had energy. I wanted to go out with my friends. It was almost like looking back on my life like it was a different person because things were so different for me now. But I got my first pelleting, and about a week later I started feeling so much better. That mental fog in the afternoon, it was gone. I felt like I had consistent energy throughout the day. Started sleeping better. I haven't had a headache since I started. The anxiety is much better. I just feel like I can handle whatever comes at me. Before this, I wasn't enjoying like the activities my children do. Like they're very active in sports, and I almost didn't even want to go because it made me feel so anxious inside. And I just thought, this is not normal. You should enjoy it. This is the most exciting time of life. Why am I not enjoying this? And since I got the pellets, I just noticed a big difference in that. It still makes me kind of nervous. I think that's normal, but to a normal level. And I'm feeling a lot better, and I really think this is the ticket. So I've been telling everybody, I think, what do you have to lose? Go and get your labs and see what's going on inside your body. It's customized to what your body needs. So what you need is different than what I need. Dr. Hyman and I are still working on what exactly I need. I've only had the one time, and so there's some unique things about my labs that we're working on figuring out, but it's been really good. So I'm really thankful that I did it.
Okay, thank you. So I think Sarah's a great example of the fact that this can really be helpful. Even a lot of times we think hormones, well, that's just after menopause, but there's many of us who aren't in menopause yet, but we're not feeling the way we want to feel. And so that's where this hormone optimization can come in. We're able to jump in and look at your labs and see where they're at and see how we can customize what you're getting from your pelleting. So, and then Pam here is going to talk from maybe another perspective as a patient, and then we'll get into kind of the why and how this works.
I'm Pam McDaniel. I am 59 years old, and I have been in menopause 5-ish years. And I went through menopause rough. Dr. Heineman actually told me, you're not doing this well, and I did not. And we tried Troaks, she tried with me different types of things to get me to be able to do this and not have bad symptoms. I had night sweats, I had hot flashes, I had restless feet and legs. I didn't sleep all night. I would be awake every 2 hours. My family told me I was a grouch, and believe me, I probably was. Maybe at work they probably thought I was too, you know. All those things that go with menopause, I had them, and I felt horrible. And you know, I have grandkids, and I've always wanted, you know, I tried to keep up with them, but you get tired. I was drinking, you know, 2 cups of coffee in the morning, and then at night, we wanted to watch a movie. Well, in order for me to stay awake, I would have to drink coffee again just to stay awake through the movie because I was just so tired. I had fatigue. I went back in for my annual checkup and talked to Dr. Heineman, and I was like, I can't do this. And she's like, I've got the thing. We discussed it, and actually, she didn't have to talk me into it, to be honest. It was like, I'll try it. I'm on board. I don't like feeling this way. I didn't have energy, and she had me on a med once where I lost weight and I could run, but as soon as I went off that med, my energy and everything just started dying back down, the weight came back on, and I have never been able to really get it off, to keep it off. And it'll take some time with this because I've got to build back up, because my levels were really low, because yes, I was menopause. The first night, I didn't like this, but I messaged her and I'm like, I didn't have night sweats the first night that after I got pelleted. And then by the end of that week, I didn't have any more. And every week, symptoms just started going away, and I started feeling better. And like she said about the brain fog, all that just starts dropping away. In this 3 months, my parents, I had to move them into an independent living. I've had no muscle mass. I cannot build it. I ache, and so when we're moving them, I'm moving furniture right along with my husband and my brother and my son. I'm lifting boxes, heavy boxes, and moving them back and forth. And I couldn't figure out where I got this energy, which this is the only place I've gotten it is from my hormones. And the next day, I did not feel bad. I did not hurt. And I was just amazed. You know, every week I've just felt better, and I've done great. And I want to tell you, I probably am a lifer. I just got pelleted again yesterday, and I don't want to go back to the way I felt. It was not fun. I like having sleep, and I like feeling good and living life like I used to when I was younger.
Okay, thank you. Good job. Those are great examples, and I can kind of tell you how I felt. I've actually pelleted myself, and I'll talk a little bit about that as we go through. I do love actually positive messages. Those are awesome, and I've actually gotten so many messages from our patients, either Facebook or text messaging. I feel so much better. So, you know, that's really why we decided to do this. I have struggled with hormone management my whole career with my patients because I couldn't make them feel better. And then for myself, getting into my 40s, noticing, okay, I just don't feel the way I used to feel, and really some into my 30s. And so hearing from patients who were already pelleting, they were driving to Denver, they were driving to Wichita, and they were getting these pellets, and they're like, I just feel better than I've ever felt before. There's something to be said for that. Now, I have to be convinced. I have to be convinced from a scientific standpoint and from a medical standpoint, especially if I'm going to be recommending this to my patients. I want to make sure this isn't just a flash in the pan. Is this a, you know, just the hot thing to try? And the more I learned about it, the more I was convinced, okay, I want to know more, and I'm interested in being trained. So when Megan and I went to the training, I think we were a little skeptical. We were like, I'm not sure about this. And I think, you know, our partners were skeptical. But as we sat there and we listened to the seminar and the science behind it, it just made sense. And we've been doing this now for 4 months, 3 months, 4 months? I don't know. Since February? Yeah, since February. And it's really just grown. It just kind of has exploded a little bit because people just feel better, and then they talk to people, and then they feel better. And I think there are a lot of people who would say they're lifers with this type of hormone. So we'll talk about it. You guys are welcome to leave whenever because you've kind of already heard a lot of the spiel, but we'll go through this. I'll try to make it fairly quick, and then I can open it up to any questions you guys have. So as I was talking about, we really are looking at how we are feeling. And are you feeling like this, or are you feeling like this? And this is the company slide, so they kind of crack me up with these videos or these pictures. Are you tired? Do you have headaches, like what Sarah was talking about? Are you feeling good? Are you enjoying life? I think Sarah had the best quote for me in the office when she said this was her secret sauce. Her secret sauce to finding joy in life again, because when you're so tired and you don't feel good, it's really hard to sometimes enjoy just the little things in life. So when you look at those symptom questionnaires, that's what we're looking at, is people who maybe are noticing some extreme fatigue, like especially that 3 or 4 o'clock. I was grabbing a cup of coffee every day at 3 o'clock. I'm like, I am my grandmother drinking coffee late in the afternoon. Mood swings, some people will notice that. Anxiety is probably one of the bigger ones, and in some of our men, we've really noticed that that has been a huge improvement for them as we have replaced their testosterone. That irritability, waking up at 3 or 4 in the morning, that was me, and then I was worrying about things like global warming that I cannot change. That memory fog that I think both Sarah and Pam alluded to, that just not being able to think clearly, whether or not it's because we're just tired, or is it really just, again, these hormones kind of giving us that back fog, and it goes on. So the BioT method is looking at balancing your testosterone, your estrogen, and your thyroid, with the addition of looking at like some vitamins. So your vitamin D level, your vitamin B12 level, and then trying to stabilize that and optimize those levels. I think it's important to recognize that when we look at labs, so if you were to go, I had a friend message me, she's like, I'm going in for my yearly, can I just have my doctor check my testosterone? And I'm like, no, if they're not a BioT provider, they're gonna tell you, it's normal. Like, how many times, you get these labs tested and they're like, it's normal, you're fine, it's normal, but I don't feel normal. Well, it's important to remember that lab work is on a bell curve, and we're looking at the statistical average of our geographical area. And so for some of us, you're in the normal range. I don't have a pointer. No. So like you're in the normal range, but you're down here. But when you're 20, you were up here and you felt a heck of a lot better. And then there's a couple of labs that we optimize that we know that people feel better more out here. It's that geographically, we're all down here. But that doesn't mean we feel better. The other thing is, is that a safe level to be at? And we found that yes, it is. So especially with this testosterone, I would say on average, most of the women that I'm checking are in the 20s, sometimes lower than that. 15, I think my level was in the teens, and we aim for 150. So big differences. So on average, we all might be really low, but is that where we should be? And we'll talk a little bit, but this method has been around for a long time, so we have a lot of data to prove that it really is safe to be at those levels long term. I had a gynecologist in this area tell a patient, well, she's turning you into a man by giving you all that testosterone. We're not turning you into a man. The men, we aim for 1,100, so there's a big difference, but we're not trying to turn you into a man. But the BioT method, those are the main labs that we're looking at. And again, we're looking at optimization, not necessarily what is quote unquote normal. Okay, so for men, this is also very important. We have all women here tonight, but we have done several men. I think we've had about 15. It's largely women, but we've had several men, and we've got several signed up. What happens usually is their wives get it, and then they bring their husbands in later. But the men that have done it, by and large, have felt tremendously better, mainly with energy level, again, some with some sex drive issues, but it's mainly been energy level and then irritability. You always think about testosterone, like people being on roids and they were really angry. You will find that most of the time when we optimize their testosterone this way with the pellets, they're a little bit nicer. They're easier to be around. Again, that secret sauce, finding that joy in life. There were a couple of police officers when we did our training. Part of our training was going and spending time with a mentor in Wichita who's been doing it for 5 or 6 years. We had some police officers and they talked about, I'm actually kind of nicer with this, not letting the bad guys get away with anything, but nicer, easier. I can handle situations. I'm not inflaming situations with my irritability. So andropause is a real thing, and that would be the male menopause. And it's about 20% of men over the age of 50 will have low testosterone. It's very common in men with diabetes, high blood pressure, sleep apnea, other things. We know that it is linked to early heart disease. And there's some things about hormones that I think it's surprising to some people. We all think that they're bad. They actually aren't. And we'll talk why they have that reputation. So testosterone, when you look at it, it can really provide a lot of major symptom relief. So a lot of what they were talking about with their symptoms really comes from that testosterone. Your energy level, again, bringing down the anxiety and irritability, and then it's important that it's in both men and women. Now, again, we talked about the 150 for women, 1100 for men, so there's a big difference. We have a large amount of testosterone in men, of course, but I think it's important to know men will lose 1 to 3% production per year. And that can be more in some men. I mean, we've had some men in their 30s or 40s with levels in the 200s. And then women, ages 20 to 40, lose up to 50% of their testosterone. Your testosterone is primarily produced from your ovary. And she produces a lot of testosterone, but sometimes it really goes down, and that's when we start to feel a lot of these symptoms. I don't love this slide. Again, this is a lot from the companies, but what it's trying to show you is that as our testosterone levels are lower, we have increased risk of all of these issues. For myself, the big reason that I chose to be pelleted was, one, I was checking all the boxes in the symptom checklist, but also my mom had breast cancer, and I always thought hormones were off the table. I couldn't have hormones because she had estrogen positive breast cancer. Well, we know that estradiol, so our own natural estrogen, is, let's see, let me go back. What we do know is that testosterone is breast protective. And so I was looking at this and I was thinking, okay, so if my testosterone's really low, and we got my labs back and my testosterone was really low, estrogen was pretty darn high, am I just going down that same road that my mom was going down? And so we actually, this company has studied, and we'll talk about this at the end, breast cancer patients, that we can pellet them. Now, we don't give them estrogen, but we give them testosterone. One that can be breast protective, and again, that's going to give you a lot of your symptom relief. The other thing that is important in preventing or helping, and there's not great research, but it's there, looking at Alzheimer's, your metabolic syndrome, lots of other things that this can really help with, because the lower your testosterone levels is, the higher we see the incidences of all of these diseases. So, I think for me, when I was in residency, and we'll talk a little bit about this, but in here in a minute, the Women's Health Initiative came out, and that's what all of your, doctors you may talk to are basing a lot of their hormone decisions on. So the Women's Health Initiative came out in 2002, and it said hormones are bad, and it was primarily studying Premarin. And do you know where Premarin's made from? A pregnant mare's urine. So it's a conjugated estrogen. It's not your own estradiol. And it was looking at estradiol versus placebo. And they said, oh my gosh, it causes all of these problems. It causes heart disease. It causes breast cancer. It causes stroke. And so we took everybody off the hormones. And I remember doing a deal in residency with my colleagues, and we were talking through how bad this study was. It really didn't prove the conclusions. The study just really didn't. The numbers weren't there. It just really was a little bit of a muddy water. And again, we're looking at conjugated estrogen. It didn't even study estradiol, which would be our more natural estrogen. Didn't even look at testosterone, didn't look at progesterone. And here we are, taking all these women off their hormones, and now what? And we know without hormones, we have some increased risk of disease. So why is that still the way that we think? I don't have a great answer for that. I really don't. I think somebody even raised their hand in our seminar, like, well, so why do we all still base all of our hormone decisions off the Women's Health Initiative? It's such a bad study. I don't know. And so sometimes this is seen on the outside of regular traditional medicine, when in actuality, this has really good research behind it. It's got science behind it, and it makes sense. So these are the positive effects of natural testosterone, which we kind of talked about. Menopause, symptoms can begin up to 15 years earlier. They can last for forever, as we were talking about earlier with those hot flashes. And it says that exactly there at the bottom. You know, most women do not ever get over or get through menopause completely and be completely asymptomatic, okay? And in menopause, we know that those numbers really change our heart disease. Again, those hormones are important. You know, the Women's Health Initiative said, oh, hormones are gonna make you die. Well, actually, the lack of hormone is an issue as well. 1 in 7 premenopausal women die from heart disease, but postmenopausal, that number goes to 1 in 3. So what's the mechanism there? Estrogen. So estrogen is important. It is present in both men and women, and we don't want to drive the men's estrogen so low. They still need a little bit of estrogen. It has over 400 functions in the body, kind of crazy. It does help control those hot flashes. So that would be the main symptom relief we see from our patients, I would say, would be that. And then also can help our mood. It increases our happy hormones. Okay, so this kind of talks about those positive effects. So hormone therapy, again, going back to that 2002 study, the Women's Health Initiative, it was on 20,000, it was this big, huge study, it was first of its kind, really on women, and so it was this big deal. Really, it wasn't a great study, it was very, very flawed. And so then all these women were left with like no alternative. You know, I mean, I watched my mom go through breast cancer treatment and surgical menopause, and it was rough, you know, really rough. And she was really left with no alternative. So when we look at hormone replacement, what we have been offering, and for myself, so I come out of residency, I know that is flawed, but that's the only kind of alternative I have is, well, some Premarin or tough it out. Here's some natural methods. Here's all of these medicines to mask your symptoms. So we always talk about, we're trying to look at what's the underlying problem. Can we fix that, or do we just want to put a Band-Aid on it? Here's a pill, and here's another pill, and here's another pill. But really trying to look at kind of the functional medicine, like how do we help you feel better without just giving you a pill for the symptom? There are some things that we can't control, and there are some things that this isn't going to fix. You know, if you have fibromyalgia, is it going to fix your muscle pain? Not necessarily, but could you feel a little better? Yes. So when I came out of residency, I'm struggling, and so Dr. Cup and I went to a bioidentical hormone, training, learning how to do the troches, like what Pam was talking about, the creams, trying to get more back to this bioidentical, so not the Premarin, but how do we mimic our own hormones? And I did that for several years. The difference is my patients somewhat felt better, but not tons. What I knew from that training was all of the research that I hadn't been given in medical school and residency about estradiol and bioidentical hormones. So there actually are studies out there that show it to be very safe, very effective, but it was hard. I didn't feel like my patients were feeling better. Often I was maybe sending them on to another hormone specialist in Wichita or Denver, and they still weren't feeling great. And then I started to hear about these patients doing the pellets and how much better they felt. When we went to the training, the thing that helped me was, one, I did have that background, so I knew the research and I knew it was there, but then seeing that they have this system in place. And it's a system, here's where your labs are, and then the company has this all built out. I plug in your labs, Megan plugs in your labs, and it tells us how much you need. And that's based on their 10 years of research in this company in particular. So when we look at it like synthetic versus bioidentical, so synthetic would be like that conjugated estrogen or your Premarin or Prempro, and then your bioidentical, again, pills, patches, creams, and gels is what I was doing, and there's all kinds of different combinations you can get. And there's some people who really have the art of that down, and they do well and their patients feel better. I just wasn't getting there with my patients. So this kind of talks about the problems with some of those methods also. Patches are just kind of a pain. We do see some weight gain. Most people don't absorb them real well. Creams and gels, it's just hard. You got to rub it in twice a day, and again, it's not great absorption. How are we really affecting your levels? There's not great direction for me to say, okay, is it working? Is it not working? Where are we at? And then again, what's in there is estradiol, which is a little different form of estrogen, and that does not have the benefit that the estradiol does that we give you in the pellets. Doesn't have the protection for the bones, the heart, and the brain. So estrogen, it's not just one estrogen, there's lots of different estrogens in our bodies. Injectable testosterone, this is the other thing that I struggled with for men. I did have have several men in my practice that I was treating for low testosterone with the shots. This is a synthetic hormone, so it's really not very bioidentical. It goes through your liver, so we do see, your normal natural hormones aren't going to do that. And so we see a lot of other problems with those hormones going through that liver. And again, biggest issue I saw, I had one guy, and his testosterone was like 150. He's exhausted. I knew he needed testosterone. But every time we do it, he was like, I'm a bear. My wife and my kids can't stand me. So I'm still trying to convince him to come back to testosterone, but to do it with pellets. But so the bioidentical hormone pellets, they're natural. I mean, everything, how natural is anything, but they're somewhat natural. They have the same molecular structure as your natural hormones, and they last longer than the other treatments. So what we do is we typically bring you in, we have a hormone consult, and you do your labs the week before. We do bill your insurance for those visits because we're a rural health clinic, we're seeing you for kind of chronic issues anyway, so we can kind of do a whole hormone assessment. Then we can talk about, okay, if these pellets are gonna work, let's go ahead and do them, we can do them. We insert the pellets just in the fat tissue in your butt. We numb you up beforehand, and they're small little pellets, and they go right in into that fat layer there. A little sore for a few days, but it doesn't last too long. And then for women, we do those every 14 to 16 weeks, depending on how long they last for you. And that's different for every woman. And then for men, it's every 5 to 6 months. So we tend to bill your insurance for the visit and then also the labs. Sometimes your labs aren't covered because you have a deductible. We try to give you the heads up on that, and most insurances aren't covering for like vitamin D levels. But if we find you to be low, then you have this vitamin D deficiency, and your insurance can cover it. Again, this is all individualized dosing. So we're looking at what your labs are, and then in follow-up, what are your symptoms and how are they doing. Just history of pellets, they've been around since the 30s and 40s. This company has been around for about 10 years, and the reason we went with this company was we had a patient that was through Bioidentical, but as the more I researched like different pelleting and where different companies have been, this one was very physician-driven, very research-driven, and really just had the best outcomes that I could see. 5 or 6 years ago, I think our mentor had said they had about 1,500 practitioners across the United States, and they have over 5,000 now. So it's definitely growing. Okay, so this is kind of the other point I think with the pellets is that anytime you're doing injections, implants, patches, you can see how your levels kind of go all over the place. The nice thing about the pellet is it's pretty consistent. Until and it can run out a little early. Mine definitely ran out a couple weeks beforehand. I could feel it. I was like, oh my gosh, I'm tired again. But there's some things that we can kind of tweak with that, like Sarah was talking about. Okay, so again, this is based on the right kind of hormones. So we're using bioidentical hormones only, the right amounts. It's individualized dosing, and it's based on their research. I plug in your numbers. It's kind of a just cut and dry system, which I really like. And then again, the right delivery system, by doing it in the fat there, in that layer with those pellets, you're getting good absorption that's more similar to your normal hormone metabolism versus taking a pill or something like that that might go through your liver and you have to metabolize a little bit differently. Again, safe, evidence-based, it's clinically effective. We don't see these uneven levels, no roller coaster, the convenience of not having to, take something every day, but getting these pellets, that's really nice. Low side effect profile. Certainly with testosterone, some women will notice an increase in acne or hair growth. We haven't had tons of that. Honestly, none until just recently. I had a couple patients, and there's some medication we can do to help handle that. But most have done very, very well. And again, no evidence of increased breast cancer risk. Because it does not stimulate your breast tissue. No increase in blood clots. One of our patients, the whole reason that she's probably the reason we did this, was she had a stroke, and her neurologist said, these are the only hormones you can take. So even if you're on a blood thinner, you've had a history of stroke, this type of hormone therapy is safe. And again, studies are showing, and we're seeing more and more of that, that the hormone optimization is protected to the breast, bones, heart, health, lots of different things. And there was a big concern too about men and prostate cancer, and there's been a lot of papers and they've submitted those, and I've got those available if anybody has questions, but it does not increase the risk of prostate cancer either. So there's a lot of other slides here, but I think that's pretty much the meat of it.
So you're saying that the insurance won't cover the pellets?
So yes, so I didn't get to that. The insurance does not cover the pellets, so those are cash pay. And again, you know, I would hope at some point they would, but they don't now. So for women, it's $350 for the pellets. And again, it's every 12 to 16 weeks, depending on how long they last for you. So far, we've just been at 12 weeks for all of our patients. I have one that's going out to 13. And then men, it's 700, right? 700. Yeah, I'm sure I'm saying that right. 700, but again, it's not as often. And so they would be every 5 to 6 months. And I, you know, a lot of times lab, again, you're gonna hit your deductible with it, that may happen. So we always kind of give our patients a heads up on that. And some of the lab is the same kind of stuff that you may already get, like in a yearly physical, so like cholesterol, blood count, that kind of a thing. So if you've already had that in the last, you know, 6 months or so, we wouldn't get that. And then we repeat your labs 4 to 5 weeks afterwards to see where you're at. And then make sure you don't need like a little boost. They do tend to underdose our patients just because we can't take it out. You can't take them out, they absorb. And so they tend to underdose, and only I think about 10% of all patients ever require a little boost. We give them a little extra hormone at that 6 week, I guess, for women, 4 week for men. And then we don't check labs again until that next year. Yeah, that's what they kept quoting. I don't know if that's exactly right. So when I was thinking about it, so we'll do like the other thing is the nutraceuticals. So we do nutraceuticals that go with this. So these are kind of these natural kind of herbal, you know, vitamin supplementation kind of stuff. Now, there are a lot of biotique providers that will recommend a lot of them. We don't necessarily. I'm only gonna put you on the ones I think you need because I think sometimes we can get a little overwhelmed with taking too many pills. I don't love taking pills. And I went from taking nothing to taking several with Biote, but I feel a heck of a lot better. So.
See, I'm already on vitamin B12, B6.
Yeah, and we've had some patients that have already been on it and their levels looked great. Then we've had some patients who have been on it and they didn't. So I was taking vitamin D. I've been vitamin D deficient for years, and I think I was taking like 3,000 a day, something like that. And my level was still not where it needed to be. And so then I started their vitamin D, which is a little different formulation. And my level went to 100. So they definitely are very effective. I've had a couple patients that did not raise their levels, and they've probably got some absorption issues, and we're doing some different things with them. So again, it's very individualized. And again, if you're already taking something like that, your level looks good, there's no reason to add anything extra.
So if you're taking someone that take vitamin D, and take the estradiol.
Yeah, so if you're already on estradiol, what we do is once you have the pellets put in, you stop it 3 days later.
So you don't have to get off of it before testing to see your natural levels.
No, and because really your estrogen level, really we're looking at, you know, where you are on the menopausal level. So we look at what's called the FSH, and that's what stimulates, you know, it's your brain trying to turn on hormones. We look at that, we look at your testosterone, so we look at other things, and you don't have to stop it. Yeah, because that's kind of a fear, like, oh, I'm not going off this for, you know, and feel horrible for weeks or months, so.
If you have breathing issues and you take steroids, will this have the effect with your steroids?
It doesn't. You know, and there's been some talk, and there's some papers and some different research talking about how this really optimizing a lot of this can help our healing, can really improve just our overall body function. A lot of people will ask us about age. You know, they say there's no age limit, or, you know, we've done some young women in their 20s. We've done, you know, Dr. Seacrest that we train under, his mom comes and gets it done. I don't know how old she is, but so, you know, And I always tell patients, if you wanna try it and then you don't like it, we've only had one patient really say, I'm not doing this again. She didn't like it. Sometimes if you're so menopausal, the first pelleting, you can maybe not sleep well, you can feel maybe not great initially. There are some people who don't feel like the dramatic, improvement that you saw with Pam and Sarah doesn't come with every patient. There are some patients who it may take 2 or 3 pelletings before they fully feel better for various reasons. So, and we're still kind of, learning the art of that, I think, a little bit too, because we're just fairly new into this. That's the other thing I really liked about this company was we have Dr. Seacrest I can call and ask questions. He's been doing it for 5 or 6 years, and that makes a big difference. When I was trained on compounding those hormones, it was like, well, good luck, and you'd have this patient, and I'm like, well, what do I do? And we talked to the pharmacist, and we try to figure it out, and we could never figure out where they needed to be. Pam could tell you lots of stories of me trying to change your hormones, and things just didn't get better. So, yeah. So, any other questions?
So you contact your office and set an appointment?
Yep, you can call our office and set up an appointment, and these lovely ladies back here, this is my team back here, I didn't introduce them earlier, but Kaylin, Anna, and Amanda, and they have been on this journey with us. Bless their hearts, because we've gotten very, very busy with it, but yeah, you just call them and